Hello, everyone. Welcome to Being Patient Perspectives. I'm Deborah Kahn, founder of Being Patient. One of the things we like to do on Being Patient is explore hypotheses that are out there and need more research put behind them. I was very intrigued to read a book by Nicole Bell, who is here joining us happily today. She is the author of a book called What Lurks in the Woods, and the struggle and hope in the midst of chronic illness. The book is the story of her husband's journey who got an early diagnosis at around 61 years old of early onset Alzheimer's. She tells that story and explores the possibility that the road to neurodegeneration could have started with Lyme disease. So Nicole, thank you so much for joining us and welcome.
Thank you. Thank you for having me.
So let's start for our viewers who haven't read What Lurks in the Woods. Tell us a little bit about the early signs with your husband. Let's start there.
Yeah, so I would say his first symptoms were all, mood-based. He became depressed, he became irritable, he became, frankly, kind of nasty, and that we were arguing all the time, which really wasn't characteristic of our relationship. And I just attributed it to lifestyle changes. I mean, we had 2 young children. Russ had stepped back, kind of gone into early retirement to be Mr. Mom. And I figured, well, maybe that's just not the right move, and then I encouraged him to go back to work, but he didn't really want to do that. There was just his personality really changed. And then I thought we were going to be headed for divorce because it was just getting really combative and just not a happy relationship. And then in 2016, I realized that he was starting to have memory issues. He would forget the code to the house alarm. He would forget the time to pick up the kids. He would constantly lose his keys. And that was when I realized that something more sinister was at play.
So, 61 years old, he had no family history of Alzheimer's, is that right? And so
right.
What made you suspicious? I mean, most of us would be so devastated over a diagnosis of early onset Alzheimer's that we probably would be paralyzed with just in shock. What made you think, what could possibly cause this?
Well, I mean, I think it just didn't make any sense. I mean, I went through and I did the genetic testing. Every, marker that I could find, I had him tested and he tested negative. And I think it's just kind of the way I'm wired. I'm an engineer and I've worked in really complex systems and robotics and lots of really complex systems. And there's always a reason, there's always a root cause that's causing something. And so I'm trying to figure out, he's very healthy. He had no comorbidities. He ate a Mediterranean diet. He exercised. I mean, all the things they say to do for brain health, he was doing them. And so it didn't fit and it didn't seem to make sense. And so I kept looking for other answers. And actually, before we got the diagnosis of early onset Alzheimer's, Lyme disease was my first thought. I mean, my husband was a hunter. He was constantly in the woods. He did all the landscaping in our property. I mean, I had personally pulled dozens of ticks off of him, and he had lived all over the country, including the Northeast, the Southeast, the West, all over. And so, I had him tested at the first doctor that we ever went to, and he tested negative, unfortunately. And so we kind of got thrown off the trail. And that was when we went to neurology and got the diagnosis of early onset Alzheimer's.
I mean, I guess what I wonder is, why would you even think Lyme disease in the first place? Most of us wouldn't put those two together.
Well, I mean, when I realized he was having cognitive issues, you just start on Google, right? And you start looking at brain fog or, things that are just kind of markers. And one of the things that came up was Lyme disease. And another thing that came up in my searches was exposure to heavy metals. And, because Russ was a hunter and we did a lot of shooting, one of our biggest hobbies was sporting clays shooting. And you get exposed to a lot of lead. He did a lot of reloading of lead pellets. And so I was worried that maybe his exposure to lead was leading to cognitive decline. And so those were like my first 2 thoughts. And we went and we got some initial testing and it threw us off the trail. But then later on, we really figured out, as we dug in further, we realized that actually was the root of his issues. It was just a matter of how to test in the most appropriate way.
Why was it so hard? Okay, tell us a little bit about the Lyme. Like, how did you finally find out that he actually, you mentioned that at first he tested negative.
Yeah.
How did you discover and why did you keep going? Once you get a negative result, usually people will be like, oh, it's not Lyme.
Yeah, well, I kept pushing for a long time. I went to multiple neurologists and they kept really giving me no answers. And I had almost given up. I had pretty much given up and I was starting to get all of our affairs in order and trying to figure out what to do. And then it just happened to be my brother who called me and he said, hey, his wife had been having health issues for years and had been to doctor, and they had finally figured out the root cause of her illness, which was Lyme disease and 3 different co-infections. And my brother's a doctor, so he started researching and he just said, hey, Nick, I think that this is the reason for Russ's decline as well. And I'm like, yeah, I know. I had him tested and it came back negative. But then, we talked about the diagnostics, and the problem with the CDC recommends a methodology, which is the standard 2-tier test. And that looks for the immune system's response to the bacteria. The problem is when you've had a chronic infection for a while, your immune system is suppressed. And so you may not produce enough antibodies to actually trigger the test. So in order to test positive, you need to have 5 bands of these different antibodies on the test. And Russ only had 1, so he was considered negative. But we went back, my brother convinced me to have him retested with the specialty lab. And instead of doing an antibody-based test, this was a PCR-based test looking for the actual bacteria itself. It looks for surface markers on the bacteria, just like what we do for COVID, right? Same exact technology. And with that methodology, he actually tested positive. And
Okay,
so,
now we should say there's really no scientific link so far that Lyme could lead to Alzheimer's. But you found that, like, what was the link that you discovered, and how much do we really know at this point in time?
yeah, I mean, there's a lot that's in the literature. If you look through the research, I mean, as early as the early 1980s or the 1980s, there were links of pathologists finding the Borrelia, the spirochetes, within the plaques of Alzheimer's patients.
So the Borrelia, let's just explain to people what that is exactly.
Yeah, so Borrelia is the bacteria, the name of the bacteria that causes Lyme disease. And it's a spirochete, which is very much the same type of bacteria that syphilis is. And syphilis is known to cause dementia. And spirochetes are known to cross the blood-brain barrier and infect the, your neural tissue. And so there's been lots of links. And over the years, it's been reported in the research, but because Lyme is just such an interesting space, let's say that, in the research, a lot of that continued research hasn't been funded. And so I think some of that's starting to change, and a lot of people are really starting to look at the root cause of infection in Alzheimer's disease, but it just hasn't received the attention that it deserves from a scientific standpoint.
Okay, and I can imagine, like, even a lot of doctors might have thought this was like crazy. Like, how did you get, did you get anyone in the medical establishment to really take you seriously and explore this?
Yeah, I mean, you really need to start going into doctors that treat Lyme, in order to do that. I think even in the later stages of his disease, I would go into major universities in the neurology department, and they look at me like I'm crazy, But I think people who have been treating folks in the Lyme space for a while have seen this multiple times, and it, doctor's perspective, but and they've had people that they've treated and gotten better, I mean, just in terms of cognitive decline, and then all of a sudden they get their memories back. I mean, even my sister-in-law, to a certain extent, she had a lot of confusion and brain fog that was lifted through her treatment. And so the causality and the treatment, if you find the right doctor in the functional medicine space, I think you get that kind of support. But in the traditional modality, no.
So what did you find with Russ? Did he, I mean, obviously, once you found out that he had Lyme, you treated the Lyme, and then what?
So yeah, we treated so we had Lyme and 2 co-infections. So in addition to the Borrelia burgdorferi, which is the bacteria causing Lyme, he also had Bartonella henselae and Babesia duncani, both of which are common co-infections in Lyme disease, and both of them can lead to cognitive issues. And so we went on a very broad spectrum course of antibiotics, and we had lots of ups and downs. I mean, there were times when and he did start presenting with joint pain and other things that were coming on later. And a lot of those symptoms started getting alleviated with the antibiotic treatment. And there were times when we were, very hopeful. He started to do better. His cognitive performance seemed clearer. But I think over time, we really just couldn't get ahead of some of the decline that occurred. I had mentioned heavy metals earlier, and we did find out that was a significant contributor in his case. And some of the treatment for that led to additional challenges, and it just became a downhill slope where we just couldn't get ahead of it. I kind of liken it to a forest that's on fire and you're trying to quench a portion of it, and we couldn't get ahead of it. And so he continued to decline cognitively.
So the bacteria in Lyme is found, it does get into the brain. Is that right? So
Yes.
why wouldn't we know more about this? I mean, we now know, like, people with COVID a lot of them get brain fog, and that brain fog can last a long time. I mean, some long haulers, I don't even know if we know how long is long at this point, right? So I guess what I'm trying to say, it's not that far-fetched of a hypothesis. I would wonder, are doctors who are treating Lyme, do they say, oh yeah, this is typical, this does go to the brain and it does cause problems in the brain?
I think that patients or doctors that treat Lyme, they're very familiar with that. I mean, Lyme, the bacteria itself, it feeds on collagen, so it can affect your joints, it can affect your brain, and it can affect your heart. You get Lyme carditis. A lot of heart issues can also be caused by Lyme disease, but those are just not as well known. I think that, unfortunately, just because of history and politics, the Lyme education and the research has been underfunded and misunderstood. So people think that you have to have a bullseye rash, you have to have a fever, and you take 2 weeks of doxycycline and then you're fine. But unfortunately, that's not the case. And I think a lot of that is starting to become known, and there's working groups in the government within the HHS, and the CDC is starting to look at some of these recommendations again. So I think a lot of that is starting to be rediscovered and re-looked at. But in terms of Alzheimer's research, it just has been underfunded. I think a lot of people have been focused on amyloid beta and clearing that from the brain, but the infection hypothesis has been, and not just with Borrelia, but with other bacteria and viruses that are in the brain. I mean, those can potentially cause issues. And I think it's really just that link to inflammation and causing a degeneration, to all of a sudden, instead of building your brain activity, you're starting to get destruction. And that's a viable hypothesis that needs to be explored.
Yeah, and I should say, I mean, being patient, we've done a panel on this with some of the leading experts who, are researching this hypothesis. And, we should point out, this is not a reason for everybody who has Alzheimer's. It's more so like outlier cases like your husband who can't really find an explanation. So, really more and more of science is coming to agree that there are many roads to Alzheimer's, right? And there are many factors that can influence whether or not you reach that tipping point. This just being one of them.
I mean, Alzheimer's is a very complex disease, and I think there's lots of different types and there's lots of different causes. And so that's what I'm really passionate about, is what is the root cause of the decline and what is causing it in the first place? Maybe it's not infection, maybe it's metabolic, maybe it's, other functions, maybe it's blood sugar levels. There's lots of different things that can lead to cognitive decline. It's a matter of finding out what is relevant for the patient that you're caring for.
And you talk a little bit about this in the book you talk a lot about it actually, but your husband, when he was being treated for Lyme, there were periods of hope and then not, right? And then things tended to spiral. So tell us a little bit about that. And, did anything really help? Or, and we should tell people that, your husband's in a very severe state now of Alzheimer's disease. He didn't recover. So tell us a little bit about, your experience with that.
Yeah, I mean, I think there's lots of ups and downs of treatment. And as I said, we did see lots of periods where he was getting better, just, in terms of not necessarily his cognitive capabilities, because I believe that once you do get some of that decline, it's difficult to rebuild. But, a lot of his mood behaviors, we were able to get stabilized. A lot of his, aches and pains and other symptoms, we were able to get stabilized. But I mean, he had deep rooted infections. By the time he was diagnosed with Alzheimer's, it was already in his PET scan classified as late stage disease. And it was several months after that before we realized that it was Lyme was the root cause. He was diagnosed with Alzheimer's in January of 2017, and we didn't start treating for Lyme until over a year later. And so, there was a lot of time lost in that journey. And I think that the confounding factors of not only the three different infections, each of which can be nasty, along with he had very elevated levels of lead and mercury. He was some of the highest that this doctor we were working with had worked with a lot of heavy metal cases, and Russ was one of the highest he had ever seen. And so I think when you put those two things together behind the blood-brain barrier, and then you try and treat and rebuild, it becomes very difficult.
Yeah.
So I think that, the decline, we were just never able to get ahead of it.
Right. And what is it? I mean, when you treat for Lyme disease, is it just antibiotics, or how are you treating it?
So we started with a broad spectrum antibiotics. We were on IV antibiotics and oral antibiotics. And he was also on herbal therapies and just, treatments to kind of support his immune system to help fight off the bacteria. We did antibiotics, a broad spectrum, for a little over 6 months. And then after that, we transitioned more to herbal protocols along with more targeted antibiotic therapy. And so, in that, there were, like I said, there were lots of ups and downs. I attribute, one of the things, as I mentioned with the heavy metals, we did some chelation treatments trying to draw the heavy metals out of his body. And after some of those chelation treatments, he definitely took a turn for the worse, and he started hallucinating. He started having lots of negative symptoms. And so I believe, I still don't exactly know how to tell people who have heavy metals, how to treat properly. I think that kind of stirred up some of what was going on and actually made it worse, unfortunately. But he was on a negative trajectory anyway, so I think we were willing to try what we needed to do in order to get him better.
Do you know that did you ever get a PET scan or a spinal tap to confirm that he had plaque or tangles in his brain?
So no, we did not do a PET scan for the actual plaques. The PET scan that he had was for glucose metabolism.
Okay. So you don't know to this day if he has plaque or tangles. It's in his brain.
No, although we will be doing an autopsy to study not only the symptomology with the plaques, but also any, bacteria or infections that are at play, which is obviously what I think is a huge root cause.
I mean, I guess what occurs to me is, like, could we call this Alzheimer's, or could it be something that's mimicking Alzheimer's, but we don't have a name for it yet? I mean, has any insight on that?
I think Alzheimer's to me is more of a symptom, it's how you're presenting, and the plaques are obviously there and kind of the hallmark of the disease, but really that just means you have this neurodegeneration, you have plaque buildup. It's, again, what's causing it. And so I really believe, as I said, there's multiple types and there's multiple, vehicles or actors that are causing it. And so I think that as we go forward, just like in cancer, there'll be, there's so many different types and so many different treatment methodologies within the cancer field. And I think Alzheimer's is going to end up being the same.
One of the tricky things about Lyme and the hypotheses that, a microbe could start the process of neurodegeneration is, like, you could have Lyme and some people don't even react to it, right? So what is your recommendation? Like, how should people find out more? And should we just all be getting tested for Lyme? But because your husband, at the time when you started to see symptoms, how long was that before you think, how long do you think he was living with Lyme for?
I can think of symptoms that now, in hindsight, that I would attribute to tick-borne illness starting back to as early as like 2009. And so I think he's had it for quite some time, possibly even before he met me. And I think, if you think of you could think of the pathobiome as kind of like a tipping point, right? Your immune system can keep different pathogens at bay, and it can fight things off. But then at some point, if something happens where you have a trauma, you have a lot of stress in your life, you have something that your immune system all of a sudden becomes suppressed, then these pathogens can now start to flare and become more of a problem. So I personally do believe that more people should be screened for tick-borne illness, especially if you're having some sort of chronic symptoms, pain, fatigue, mood changes. I think these are things that you should start looking at whether tick-borne illness can be a factor, particularly, I mean, and I would say, particularly people who live in certain parts of the country, but Lyme is everywhere, and people travel everywhere. And so you never really know when you could be exposed. And so I do think that screening is a useful tool. And, but again, the way you get tested really matters, as we found out in Russ's case. You know, the standard Western blot that is used by the CDC, I mean, they've done studies published in 2020 that show people that actually present with the rash that they know have Lyme because they have the typical bullseye, only 29% of those people test positive with the standard 2-tier test. And so there's a real problem in diagnostics that needs to be fixed.
So how did Russ get tested? I mean, how did he confirm that, in fact? Because you mentioned in the book that the first time around it was negative.
Yeah, so basically switch to a PCR test looking for the bacteria itself. And the other key thing is at least Borrelia causing Lyme tends to congregate in the bladder. And so often urine is a better sample than a blood test. And so we actually did a urine test using a PCR methodology, and then he actually tested positive.
So we have a viewer asking a question right now, and she is asking, what about Lyme and ALS? Do we know anything about that?
Yeah, I mean, I obviously haven't studied that as much. I have talked to some doctors that think that there are a lot of links between not just Alzheimer's, but other types of diseases. And so I think that, you know, anytime you have neurodegeneration, it's worthwhile to look and see if tick-borne illness is a factor. You know, there's a lot of misdiagnosis in, you know, with MS, ALS. I mean, those are, again, they're all theories, but I think that there's grounded in science that these infections can actually take residence in your brain and start causing these neurodegenerative diseases. And so I think it's worth screening.
So Nicole, based on your research, and obviously you're not a scientist or a doctor, but where are we with the research into microbes and the brain and what destruction they can cause? How much do we actually know that's been proven scientifically?
I mean, I think that there's probably people that are much more, attuned to speak to that than I am. From what I see, there's enough evidence to show that it's a valid theory. They've been shown, they've seen, in particular with Borrelia, they've seen spirochetes within plaques. There's known mechanisms to say that actually amyloid beta can be part of your innate immune system and can actually be a defense mechanism to microbes. And that, again, is indicative of the fact that you might have an infection harboring. So I think, unfortunately, it's been grossly underfunded. And so what I'd like to see is more research in the space of people looking at these different microbes and then also doing clinical trials to see, okay, let's understand the pathobiome for, these patients that are getting, infected and start looking at that and then start treating their particular pathobiome and seeing if they start having better outcomes. And so these are the types of studies that need to occur. And, fortunately, one positive thing of COVID is that people are really starting to realize that there can be links between cognitive performance and infections. And it's starting to open up new avenues of funding, but we're just not where we need to be to really get those true scientific answers yet.
Okay. And to anyone who wants to read Nicole's book, I read it in one night. It's a real page turner. She really does a great job of chronicling her family's experience and how she kind of uncovered what hypothetically could be a root cause of neurodegeneration. The name of the book is What Lurks in the Woods: Struggle and Hope in the Midst of Chronic Illness. I guess you can get it on Amazon. Is that right, Nicole?
Yes, and Amazon, Barnes & Noble, anywhere, yeah.
Okay. And, thank you for writing this book. Obviously, as you stated, a lot more research needs to go into this to see if this is a credible theory hypothesis. And if so, perhaps we can stop one pathway a lot sooner. So thank you so much for making us aware of this. Fingers crossed that more research goes into this.
Well, thank you so much for having me. It's been a pleasure.
Okay, and so if any of you want to know more about these interviews, of course, we always post them back on beingpatient.com, but please sign up for our newsletters. We tell you who's coming up. We like your questions, send them to us. But for now, thanks very much for watching.